150,000 to 275,000 cases a day. Now they are actually increasing above 300,000 cases per day globally, and this is up to August 29th. Deaths, which tend to lag the increase in cases, had slowed down around May, June. Then they picked up around July, August, and deaths are now around 6,000 deaths per day globally. So that's where we are with the international picture. Regionally, and this is nothing to celebrate, but this is just to understand what is happening regionally. I just referred to an article in today's Express. 93rd COVID death in Suriname, and toll rises in 3 more nations. So the region, as a CARICOM region, from far south of Suriname up to far north as Jamaica, we are not being spared. I just want to quote something that my colleague, who I speak to off and on from Jamaica, the Minister of Health, Dr. Christopher Tufton, because we are in the same boat together. And he said, Jamaica is now in the community transmission phase of COVID-19. And this is the time when our resources will have to shift to monitoring the spread and characteristics of the virus, identifying and managing severe cases, preventing onward transmission. And I think I will sound repetitive here now, alleviating strains on healthcare services, informing the public, and reducing overall social and economic impact. So globally, there is no sign of slowdown. Regionally, there is little sign of slowdown, especially in the parameters of deaths. While we have recorded our 50th death, and our deepest condolences go out to these families again. Our death rate, in speaking to Dr. Michelle Trotman, Dr. I.A.N, CMO, is well below international standards. I mean, that is nothing to celebrate because 50 families and communities are in mourning. So, Prime Minister, that's where we are globally, that's where we are regionally. We just ask the population to once again adhere to all the guidelines we have put out, and we still maintain that our strategic objective at the Ministry of Health is to return to cluster spread, taking the country back from community spread to cluster spread in the shortest space of time. Thank you very much, Honorable Prime Minister.
Thank you very much, Minister. Could we hear from Dr. Paris from now on the situation with respect to Trinidad and Tobago?
Thank you, Honourable Prime Minister, Honourable Ministers, members of the media, members of the viewing and listening public. Our daily update for September 12, 2020 is as follows. Our samples submitted thus far, 26,551. Unique patient tests, 23,508. Number of repeated tests, 3,043. Number of samples which have tested positive are now 2,892. This represents approximately 0.21% of our population, meaning that 99.7 roughly percent of our population is still naive to this virus. In terms of total number of active cases, we now have 2,076. Number of deaths, as Minister said, now stands at 50. Number of persons discharged, 766. 67 additional persons would have tested positive in this morning's 10 a.m. update. In terms of our facilities, at the Couva Hospital and Multi-Training Facility, we have 80 persons now, 5 persons in ICU, 4 in the high dependency unit. At Cora, there are 29 persons. At the Arima General Hospital, we have 4 individuals. In terms of step down, at our UE Debe campus, we have 7 persons. UE Canada Hall, 44. UE Freedom Hall, there are 68. The other step-down facilities remain vacant at this point in time. Within the quarantine centers, the Home of Football, there are 4 persons. Chancellor Hotel, 17. Cascadia, 6. Regent Star, 30. I believe at the Paria Suite, we were able to decant 94 individuals yesterday, and we are expecting a group of 90 plus again sometime later today. In terms of our, if Prime Minister, you will allow me just a minute, I'll ask Dr. Trotman to give us a little brief update as to what is happening in the hospitals with our patients. She will speak a little bit about what we have spoken before regarding silent hypoxia and what it means for the persons at home in particular, and how to recognize symptoms and signs of deterioration. Dr. Trotman.
Honorable Prime Minister, ministers, members of the viewing public, members of the health community. First off, my deepest condolences to all 50 families that have suffered loss. I would like to give an overview of what the COVID patient sometimes experiences, very briefly, particularly as it relates to patients who require oxygen. Many of our patients who have COVID suffer with problems that will make their oxygen levels low. And as you know, oxygen is a fuel. That's what we need for energy. And patients, when they don't have oxygen, become listless, tired, may have symptoms, shortness of breath, chest tightness. But once they get oxygen, those feelings go away. And patients begin to feel that they are okay. They feel very comfortable. And unfortunately, what we have seen with a couple of our patients, a number of our patients, is as they begin to receive this oxygen and they begin to feel better, is they take the oxygen off. And when they take the oxygen off, what happens is the cells that require it, unfortunately, suffer and can die. And we've seen that some of our patients who have been some of those 50 have done that. Even while their oxygen requirements were very high, they took their oxygen off and eventually suffered demise and compromise. So I want to say first off to people out there that you have the opportunity lots of times to be communicating with your relatives. They sound okay. You might not be able to pick up that they're okay. They might be able to. The caregivers are there. They are encouraging, but they feel okay and they take it off. Encourage people that if they are in the hospital and the doctor has prescribed oxygen, then keep it on. Do not take it off. That's one of the biggest messages I can give. The other thing is the numbers. I know we are all alarmed at this number 50 that we have gotten to with our deaths, and it is too much. One was too many. But when we look at our total numbers, overall, we fall below the average. We fall below the international average, and well so. We hope that we have no more deaths, but it is quite possible. I want to say to the healthcare team, the healthcare givers out there, the ones who are doing this fight, thank you so much. I know how they feel when they have to call and report a death, and I know you feel that it's not our relatives, but it's a loss for us. Because what we take is a motto. What we take is a motto, really, to save lives.
Prime Minister, if you will allow me, before Dr. Trotman leaves, please explain to the population what happy hypoxia is and what a happy hypoxic patient is.
Well, it's just as the word says. That when you drop your oxygen, actually you have a period there where you get and you feel like you're okay and you're happy, but it's not good. Okay, so, and they do want me to emphasize that when you feel like you have symptoms, or even if you don't feel like you have symptoms, please reach out to us. There are many avenues that the doctors have and your nurses, healthcare has, for us to reach out to you. Let us know that you're not feeling well. Some ways that you can tell is you can't catch your breath, you can't finish your sentence, your chest feels tight. Those are some of the things. And always, please remember to distance, sanitize, and use your vaccine. Wear your mask. Thank you.
Thank you very much, Dr. Parson and Dr. Trotman. I too would like to join my colleagues up here and members of the health fraternity who are directly on the firing line, seeing, touching, experiencing the demise of persons day after day. 50 in the context of the almost 1 million persons in the world is a small number, but it's a big number at the personal level. It is somebody's father, somebody's grandfather, somebody's uncle, somebody's neighbor, some communities respected and loved person. And every time someone passes on from this virus, it ought not to be seen as arithmetic, just a number. It's a community and a nation at a loss and in pain. I've seen it said from impressive platforms that this is like the flu. It is not. It is certainly not in very many ways. And I'm sure if the doctors were to stand at the platform and tell you how it is different, you would see. But you would also have seen some of the patients, local and foreign, who would have told you about how horrible the experience is. And of course, persons passing on at this time, there's the additional trauma of the rest of us in the national community not being able to see them off in the way we have been accustomed to bring closure to their passing. That too is very painful. I myself have experienced that with my eldest brother, who didn't pass from COVID, but he passed during the time when a funeral, which is our way of treating with the passing, is now involving only less than a dozen people. So every time I see a passing of someone, I know there's a family going through what I've been through. And you also would have heard Dr. Parasam say that there are over 99% of our population that is naive, meaning have not had the body experience the virus. Remember, this virus is a microbe which has not been in the human population before. It has come into the human population and it is starting to make its mark. Where that mark is going to be left, we still don't know. We know what it's doing, but what we do know is that we are having to continue to try to live with it, to fight it, and to cause it not to overcome us. Well, how is that likely to happen? Because if 99% of the population has not been exposed to it, and upon becoming exposed to it, you either react by being mildly ill or not being ill at all, or you progress to death. How do we live with this virus, and how do we get the better of it? We have come up with the plan, and the only plan that's available to the human population is to try and prevent the virus from spreading. Because if it is prevented from spreading, it will wither in terms of its numerical strength and will be reduced, and the expectation and the vision and the want is that it becomes absent by having not propagated itself to continue as a microbe. And the way we do that are through the restrictions that we've placed on ourselves. Those restrictions are our only tool. The restriction to not gather. That is why half of the public service is at home, so that those bodies which ordinarily would have been in taxis, on the street, in the office, elsewhere, additional bodies, the government has taken out half of its labor force so as to not have the virus have these stepping stones. In the private sector, they've made a lot of adjustments as to how those in the workplace are spaced out, so that even though we're carrying on with some work and some production, that the virus is denied. If we follow the protocols, the virus is denied the opportunity to jump from one person to the other. A person who is carrying the virus and is not demonstrating any symptoms and is present as healthy and normal would have saved the population the spread if that person had followed the protocols, passed through the period when they're infectious, and go into a period when they're no longer infectious. But that can only happen if we deny the virus the space. And that is why it is so important for the little thing of spacing yourself out. And of course, in transmission of the virus, we want you to wear the mask so that droplets and aerosols coming from person to person would be eliminated or reduced. Those are the two things that are required for a human population to do to deny the virus that stepping stone, that jumping off from one person to the other. We've said that so many times. The Minister has said it 1,000 times. Dr. Patterson has said it 2,000 times. I've said it 100 times on this platform. And I'm still trying to understand why there are people in Trinidad and Tobago who firstly believe that God's going to give us a pass, and this virus that is heading to 30 million people in the world will not bother us and will not bother me, and I could do as I please, and like the frog on the hill, I have the rights to deny this and the rights to be condemned. Ladies and gentlemen, this is a very serious matter. I remember saying this when we had no death. I remember saying it when we had the first death. I'm now saying it when we have the 50th death. And I don't want to have to say it when we have 100 or 500. Because let me tell you this. It is not locking down. There's no key to lock down and get rid of the virus. If the numbers become ridiculously high and we are forced to go back to a lockdown, the lockdown in itself does not eliminate the virus. What it does is slow down the spread to reduce the effect of the virus on you. Doesn't eliminate it. Because after the lockdown, you're going to have to come out again and be where we are right now. And if when we lock down and we come out here and we start over again, all we are doing is repeating the effect of the virus. So you could lock down 4, 5, 6 times if you wish. It's just as bad or worse than the first lockdown, because if after the first lockdown we do what has to be done in a disciplined way, that is our best chance to not have to lock down again and to keep the virus at bay. You would have heard the minister say that our next target is to move from community spread to cluster, meaning that we are trying to roll back to a point where cluster would be an accomplishment, would be a better position. Recall when we were in the sporadic phase and we went to cluster, and now we are at community spread. If we get back to cluster, it would be an improvement, but we'll still be living with the virus. And that is why I've said to my colleague, the Minister of National Security, while it is not feasible to lock up everybody who's playing the fool and who's breaking the law or breaching the regulations, we really only have left serious, sustained law enforcement, because there are people in this community who only understand the heavy hand. As Prime Minister, I said to you in the beginning, we did not accept the advice of persons to have a state of emergency and remove the police, the power of the police to be constrained by the Constitution and allow the police to act without control, because it was not going to improve the position of the individual to, at the personal level, respond to the virus. So those who advised us to have a state of emergency because it was serious, to them, the existence or the declaration of a state of emergency would have indicated how serious it was. But to us and to the Ministry of Health, it would not really have changed the circumstance of what is required of the individual. To those who understand that it is an ailment, two things. One, there is no treatment to give you a cure for the virus that we have now. That may come later, but as of now we don't have a treatment that you can be treated, you get better, you go home from the hospital. And secondly, the vaccine that we are anxiously awaiting, from all reports, it is not around the corner. It's not here next month. It's not here, not even by Christmas, because the best scientific labs in the world, notwithstanding every now and then you hear somebody has a vaccine, the WHO is not advising us that there's a vaccine on the horizon of a matter of months. We are still awaiting the scientific breakthrough and, of course, the tests that will prove to the scientists that the vaccine is safe, because you can have vaccines, but vaccines have to be efficacious and safe. We're not there yet. We can't cater for that. In the meantime, what that means, we are having to live with a virus that is very detrimental to human beings. I said to my colleague, where Trinidad and Tobago is, we expect that there would be firm and sustained law enforcement. For those who believe that the only thing that they will accept and respond to is being restrained by a police officer. And as I say that, let me join the conversation now. In Trinidad and Tobago, we expect that the law will be applied to every person, regardless of race, color, creed, class, or social standing. Because those who believe that they are beyond the reach of this virus, you could say so for yourself, and that may suit you in comforting your irresponsible conduct, but in so doing, you pose a threat to the rest of our national community, to the little children who are helpless and require the behavior of adults to be such that give them a chance, to the persons with underlying medical conditions who require those who are well and moving around to behave responsibly, to those elder citizens who are depending entirely on not being exposed in the simplest way to this virus. They request, through me, to the Minister of National Security, to the police service, that you ensure that there's an improvement in the conduct of our nationals where the law applies across the board, especially to those for whom priority is partying. Persons who are partying and spreading this virus must feel the full brunt of the law in Trinidad and Tobago. It is not for me to tell the Commissioner of Police who to arrest and who not to arrest or how to apply the law. But as Prime Minister, I could tell the Commissioner of Police that the law must apply to protect us in Trinidad and Tobago from those who are not prepared to listen and not prepared to fight the fight that we want to fight to bring this virus under control. We can do no more, but we'll do the most with what we have. I had a meeting with my CARICOM colleagues yesterday. We had a fairly long meeting, CARICOM heads, on this matter of how we relate to the external community and how we consider opening our borders. Countries like St. Lucia, Barbados, Grenada, where they are entirely dependent on the borders being open so that their tourism economy can begin to receive people. And the bulk of the conversation had to do with the logistics of treating with persons who would want to come to us, to the extent that there are people who want to travel and they come to us. How do we treat with them as we live with the virus and that their presence not become a threat to us? What can we put in place to allow them to come and be here, contributing to the economies, but at the same time not contributing to our demise? Some of the reports you've had, there are different models that we considered. Some people are requiring, or everybody at this point in time is requiring that some element of testing be done. In other words, determine who comes to you. So either you test before you come, and some persons will require you test on arrival, or you come without a test, and when you come you must be tested. And also the question of quarantine and what happens if there are breaches or if there are failings in that system and so on. At the end of that very long conversation, the conclusion was that we are not in a position to open our borders fully or at all in some instances. For those countries who have opened their borders, there are some very strict requirements, and they're selective as to who comes in and from where, depending on where, how the virus is raging in different areas. Those countries like Trinidad and Tobago, where we are at community spread and where the persons coming to us are likely to come from an area where the virus is very prevalent, we still have to maintain that closed border. So the question of this social distancing, the sanitizing, the wearing of the mask, and the closed border, these are all our defense shields in the face of a virus which, as the minister has told you, is not abating, but in fact, we're seeing it increasing around the world. The question is, when does it end? We don't know. What does it do to us? Nothing good. How do we respond? In the ways that we have described. And what do we expect? We expect that we would, if we are disciplined, we will continue to work, in some instances, at reduced levels. We'll continue to take some elements of risk without being reckless. But it's hurting us. It's hurting our economy terribly. Yesterday I had a meeting with the Minister of Finance, and it is our view that this virus has cost us, and this is not the money we've borrowed and spent to pay for the response. It is losses because the economy has not acted in the way it would normally have acted. We in Trinidad and Tobago, we probably would have lost about $10 billion from our economy because we were not able to do a normal day during the period that we are fighting this virus. Of course, our 10 billion is a drop in the ocean of the losses worldwide. I mean, some of the numbers are staggering around the world as to what the losses are. And some of those losses bounce back to us here because they have not created markets that are attractive for our product. They have not. Yeah, I'm being told by the minister that WHO estimates that the global loss is $375 billion US per month. And this has been going on since what, February? Yeah. So you can understand what it is that this virus is doing to us, not just causing deaths in the way that it's being reported, but it's having a huge impact on our livelihoods because of the shutdowns, the reductions, the market collapses, and so on. And I need not go into the whole question of the loss of business and the loss of jobs that are taking place and that will continue to be a feature of the local, regional, and international economy until this virus recedes into our past. So this is a period of great uncertainty, great harm, and a period that is calling for resolve to survive it. There has to be a resolve. $375 billion US per month is something that I'm not, in my understanding of history, this has never happened before in human condition. Never. So therefore, let us understand what we're dealing with, and that is why those who see this as a joke and those who are prepared to push the envelope to see what they can get away with, this is what we all have to deal with, and we are calling for responsible conduct. I look forward to the weeks and months ahead, where I could report to you that the national community is rising to the occasion, rising to the challenge, doing the simple things, being serious, and being responsible at the personal level. And of course, for those who believe that they have to put their finger in the wound to feel it, that the pain is there for them to experience that. So, ladies and gentlemen, today is the end of the period that we had asked for when we said that we would roll back for that cycle to allow us to respond in the way we have responded in the last month. And given where we're at, we could take some comfort that our situation has not worsened. Because had we not acted, it certainly would have worsened, and worsened to a considerable level. We are not in a position today to say that the statistics, maybe I should ask Dr. Hines to tell us where we are with respect to the statistical outcome of our experiment of our recent rollback.
Thank you, Prime Minister. Good afternoon to the honourable ministers, to my colleagues, to the media, and to the viewing and listening public. As you would know, we are now 28 days in from the original beginning of the restrictions, the measures to reduce gathering, reduce the rates at which the virus is able to meet new people, uninfected people, and infect them. And what we have seen is that although we are in that accelerating phase of any pandemic, the measures are beginning to appear as though we might be seeing some success. We've not seen the slowing that we're hoping to see down the back end of the curve, down that other side of the bell that we've been describing, but we are beginning to see signs that fewer and fewer people on our daily counts, not the ones that show up in the press releases that may have numbers across a few days, but on the daily counts, we're starting to see where those numbers are starting to look a little more favorable, although they're still increasing. So we're at the point where we are encouraged to hold the course. We're encouraged to continue what we're doing, because while we're applying what may seem to be a slow braking force, we're slowing that sort of runaway train that a pandemic can be. We are not out of the woods. So what we need to do is continue to apply that braking force in the hope that the data continues to show us the trend towards some sort of ease, a trend towards some sort of deceleration. As we progress, as we have additional data, we will show that in our weekly press conferences with the graphics to suit, and you'll have a better idea, a better grasp of what we're describing.
Thank you, Dr. Hines. So, that being the case, we are living with a condition where, with 99% of the people available for infection, assuming that those who have been infected will not be infected again. As long as we have one or two people, or a few people in that population of 99% of the population, as long as you have some people in there who are designated spreaders or accidental spreaders, the situation is that the virus could be spreading amongst us. That is why it's so important that we place our expectation and our hopes on the personal conduct in denying the virus, the person-to-person contact. And because we have not seen the level of reduction that we want to see to allow us to have the level of risk that we want to take, we must continue to do what we have been doing so as to get the result that we are after. So therefore, today I will simply ask that we continue up until another cycle, to the 28th, to the 20th, to the 11th of October. The stay-at-home arrangements for the public service would remain, the rotations would remain, and with one adjustment where, because, as I said, we have to continue to do what we have to do, lives and livelihood, remember those two terms, we are in the budget period. The budget is due. The date has been given October 5th. All persons in the public service who are required to work on the budget exercise in every ministry and the Ministry of Finance, you are deemed here to be essential, and you're required to be at work, and I would leave that to the head of the public service to talk to the permanent secretaries in the various ministries to ensure that the persons to whom this stay-at-home applies are not those persons who are required to be at work to assist with the budget preparation. And by this I mean the Ministry of Finance and the finance people in the various ministries. They are now deemed to be essential and would be required to be at work so that the budget can be prepared and we go to the Parliament on October 5th and do that assignment, because so much relies on us getting the budget through the Parliament, getting the legal allocation to service the country, and to continue to conduct our business with some order and some positivity. The best positivity we've had, I must at this stage congratulate our cricketers, TKR, and all our regional cricketers and all our guests who came and who proved us correct that we could have, in a pandemic, create the health environment, which is loosely called a bubble, so that the business of international professional cricket could have taken place. I think we should take comfort from that, saying that even though the virus is there, even though the difficulty and the threats are there, it is possible to construct an environment in which we can continue to do the things that we normally would do. The same thing, I went to a couple of factories a few weeks ago, and the factory floor was humming along with work going on. People were coming out to work. There were a significant number of adjustments that they had made as to how the staff moves, where they eat, how they are deployed in the factory floor, but work was going on and outputs were coming from the factory. That is what we have to do. That's what we have to do. We can't just fall back and say that, well, there's a pandemic and we throw hands up in the air and let it get the better of us. What that cricket has demonstrated, that it is possible to get it done, but to do so successfully, you have to have the discipline to follow the advice, and I must say the advice was followed, yes, and the outcome was very satisfactory, and the processes were flawless. So let that template be a model for us. The other thing that we've done, we did consult with the public transport, the private transport personnel, the 12-seater, 18-seater, 24-seater maxis, and we have come up with an arrangement which I am told would be attached to the regulations, which is a map of the internals of the vehicles which show how they can be seated, how passengers can be seated. So you get a little more, but you also get the social distancing, and who has that?
We have it.
The Ministry of Health has it. So like, for example, a 12-seater maxi would carry 8 people. One per window. A 18-seat maxi would carry a bit more. A 25-seater maxi would carry a bit more. But they would all be specifically seated in certain seats in the vehicle, and that will allow them, I think, to get to a 65% level, as against a 50% level. And we will continue with that. So other than that, all the arrangements remain in place. I know we are tempted to want to go to the beaches and the rivers. Let us hold on a bit. And today is the 12th so we will maintain this posture for another month. And by the 28th we will review. But by the 28th we will be halfway there. It's another 14-day period, and we will do another review then, hopefully, all things being equal, all disciplines and protocols being observed. By the 28th we will have a view which will give us what the month of September look like, and we can compare September with August, and we will then have that other 14-day period going into October. If any adjustments can be made then, we would consider it then, but as of now, we are not minded to make any adjustments to what we are doing, except to say, let us continue to have livelihoods within the constraints of the protocols which are to be rigorously enforced. So if there are any questions, we will take them now. And we have all the doctors here. And we have the doctors here, and we have the Minister of National Security. So any questions which would be appropriate for any of us here, please put them now. Dr. Hines?
Good afternoon, you mentioned that you all are looking at the numbers, the daily figures, and it seems to be fluctuating, sometimes lower than other days. What exactly are you all looking for right now in terms of the numbers per day before we can lift the restriction?
Okay, the expected behavior in a pandemic situation of a virus passing through a population is that it starts off slowly, it picks up speed, it gets to a maximum, and it starts to slow down. So what we're hoping to see with the data is that we see continuing decreases in the numbers of new cases. We're not looking at a specific figure. We're not looking for a specific percentage. What we're looking at is a trend, a continuing downward trend that is supporting the understanding that the measures that we have been taking have managed to slow the movement of virus from one person to another to the stage where fewer than one person per new infected case becomes infected on the other side of the curve. When we get that R0 down to below 1, where you start seeing fewer cases being accumulating, we know that we're heading in the right direction. It's not that we have a specific threshold, a specific number, a specific date. It is an onward trend that we look at as it fluctuates, because you use the word correctly. Those numbers will fluctuate, and we're looking at the overall trend to see that we're heading in the right direction, and it's a continuous monitoring process.
I don't know if you have the figures on you, but could you give us an idea as to the numbers that we have had daily for the past 2 weeks or so?
I don't have the figures on me. The highest number that we've seen daily up to a couple of weeks ago was about 118, in spite of the fact that you'd have seen larger figures in the daily updates. As we explained, those figures extend a few days beyond or before the update itself, and figures since that have been a little lower. We're still monitoring, we're still making sure that the data set is complete, but as we monitor, we are getting encouraging signs that those numbers, the increases in those numbers is becoming progressively smaller, and we're hoping to see the other side of the curve before we start claiming, okay, it's absolutely working. So continuous monitoring, we keep reviewing the data, we keep examining the data set to ensure we have it all, and that we're making an assessment of all that is in our possession and at our disposal.
And could you give us the lowest that you've seen? You've seen 118 being the highest. What's the lowest that we have seen?
When?
In the same period.
In the same period, we'd have seen it between around 2030, it being one of the at the lower end. Again, as we update, the figures can also be revised. The figures can change. But at the early part of phase 2, what we were seeing was 6, 8, 10, 14, and it began to increase at what we call that exponential rate. The exponential rate is not as steep now as it was previously, and we're hoping that that indicates that we are beginning to see success with the measures, so we continue to monitor.
Dr. Hines, Rashad Khan, Guardian Media Limited. Would you happen to know offhand, or would you be in a position to give us an update on how many persons with in total were infected with comorbidities, and what percentage of those would have died?
I don't have all of that data in front of me, but that is something that we can actually compile.
I do have some of that data, and Dr. Trotman will explain a little bit further. So far, we have calculated that over 90% of those who have died are over 60 with comorbidities. There are a couple just below that threshold of 60 years, 58, 59. So from, let's say, 58, 59 go up, over 90% of that 50 do in fact have comorbidities. Below that age, a couple of those, obesity and so on, and I will now let Dr. Trotman go into some more detail, because we are looking at that.
Thank you for your question. The spread that we have seen with our 50 patients do show a predominance of deaths in patients who present with comorbidities. most commonly hypertension, diabetes, and in some respects also obesity are some of the comorbidities that we are seeing frequently. I want to take the opportunity, though, that to emphasize that some patients unfortunately have comorbidities but do not know. And so they may present at the time of presentation with a comorbidity that they may have had but not previously diagnosed, and not necessarily always diagnosed even at the time of presentation. We have seen other cases, where patients do not have comorbidities, but they are not the majority. We have seen a very few number of patients who are younger, very, very few, also without comorbidities, not predominant. What we're seeing is more of a hypertensive, diabetic, elderly population with some form of comorbidity.
My next question is to CM.
Before you go to the next question, let me come back here to my pet peeve of the day. I would assume, I'm not a doctor, I'm not part of the health system, but I would assume that it is possible that a number of those persons would have got infected by somebody who brought the gift to them in a very unobserved and very healthy way. Because the way the numbers have been going worldwide, there are a lot of people, young and healthy, older and healthy, who are in fact in a position to infect older persons with comorbidity who would die from the infection. So it is important for us to notice that, and that's why we are appealing to those who are perceived to themselves or to others to be healthy and strong, that you may be threatening somebody's life by an exposure which could result in death. That's what this virus is saying to us. So there's a large population of so-called healthy people who are in fact carrying the virus, and therefore if you have older people at home and you're partying outside, you're going to be having a good time outside, but you could be the Grim Reaper when you get home. That is what it is all about. So therefore it's important for us to be aware of that.
I think it is important for me to step on the heels of that. It is so critical for us to understand that we all have a role to play, old, young, with or without comorbidities, and to understand that there's silence, and silence would spread, so that people who don't know it, strong and healthy, may have it and pass it to someone who does not have the ability to fight the way that you are. That's why it's a public health disease. That's why what you do is so important to others.
Prime Minister, if you'll allow me to take the baton from where you passed it to Dr. Trotman, and I will now go one step further. And I waited for some time because I didn't want to impinge on patient confidentiality, and I am not going to. I will simply make a statement. There are a couple people who died, elderly, who we know from their history had no way of leaving their homes because they were incapacitated either physically or through mental disease. They never left their home for the past 2 years, but the virus went home and met them. And that is why I keep begging people, especially young people, you will take the virus home and you will literally pass it on to the elderly. The elderly didn't ask for this. Because that person, one or two who, for physical incapacity or mental incapacity, never left their home for the past 5 years. The virus went home and met them and they died. So you may not be a doctor of medicine, Prime Minister, but your doctorate gives you the ability to think. And we are asking the population to think before you engage in risky activity. Be responsible.
Dr. Hines, let's hear from Dr. Hines again, please.
Thank you, Prime Minister. I want to continue this metaphorical relay and pick up the baton from the Minister. One of the things that we do have as medical professionals is lots of our own personal friends who would call and ask about what to do in given situations. And what you do see is something very similar. An elderly relative is ill. You're not sure why they would be ill. Testing in the family indicates, yes, they did contract COVID-19. And when you ask, okay, so what happened, within the last week or so? What was going on? Did you go anywhere? No. We had a little birthday party, a little family gathering. At this point, while that is normal and not considered quote-unquote risky behavior, anything that brings different webs of social circles together, no matter how small, is a risk. That's why we're asking people, whether you're in public or in your private settings, to avoid the gathering altogether. Because when you bring networks together, one person has it, they pass it to a whole new network, it can get into a whole new home. And this is what we're trying to avoid. This is what we're trying to advise people not to do. Part of the new normal is to reduce the risk of connecting networks and bringing virus home by reducing some of that social activity, at least for the short term. Prime Minister.
Thank you. Let's get back to the questions again. If you have any further questions, continue, please.
Question to the Minister of National Security.
Yeah, let's have the Minister of National Security at the podium.
Right, Sana Lala, TDT News. Minister, we talk about enforcement. How has enforcement been going with regards to public health regulations with the police service? How many people have been charged for breaking quarantine, for the wearing of masks and so on?
All right, I don't have those statistics here, and I wouldn't want to venture a guess. I mean, I get reports over a period of time, but that can be provided. I'll ask the Trinidad and Tobago Police Service to pass that on. What I can tell you is there has been enforcement. As you heard the Prime Minister say, he's had a conversation with me. I, in turn, have had a conversation with the various heads of the police service or intelligence services or defense force and asked them to support the police service in increasing our enforcement measures so that you can expect to see that taking place. But we ask people be personally responsible, especially for something like the mask wearing. I was a little distraught this week to see that we had crossed well over the 100 mark. I think it was 179 was told at the police conference of tickets being issued, and that could be avoided, right, by persons just wearing their masks.
Minister, before you leave the podium, for the public, for the benefit of the public, well, you're a lawyer by practice, but by profession. The national conversation in the last 24 hours has to do with whether, in fact, there's authority for the police to act in private premises and so on, or common compounds. And also, there was a judgment that came out of the court yesterday, I think. The newspaper, one particular newspaper, that screamed a certain headline.
That was wrong.
I've had bits and pieces of